When you bring a new baby home from the hospital, you have so many questions and there are so many things to take into consideration. One of the most important things, both for yourself and for the baby, is sleep. But there are a lot of questions that go along with how the baby can safely do that. So we are talking today to Marta Pirzadeh, who's with the North Carolina Healthy Start Foundation. Thanks for talking with us.
Thank you for having me.
Tell us about the foundation and what it is that you do.
Sure. The North Carolina Healthy Start Foundation has been here in North Carolina since 1990. It's our 20th anniversary this year. And we started to reduce infant mortality across the state 20 years ago, and we're still doing it. 20 years ago, we had the worst infant mortality rates in the nation. And so we've...
In North Carolina?
In North Carolina, the worst state in the nation 20 years ago. We've made great strides, and Healthy Start has been a big part of that.
So talk to me about SIDS. We've heard the term a lot. I know when you're in the hospital, I have a 13-month-old, and they talk a lot about SIDS, as well they should, because it's something people need to be aware of. What is it exactly?
Well, SIDS is actually defined as sudden infant death syndrome, or many people know it as crib death, actually. And so what SIDS is, it's the sudden unexplained death of an infant less than 1 year of age where there are no underlying health causes or reasons for the death. The baby is generally put to sleep in their crib, parents go back in later, and the baby doesn't wake up. There's no underlying cause. Now,
we were talking beforehand about that there are certain risk factors and certain things that you can do and you can prevent. It's not preventable, but it is. There are things that you can do to drastically cut down the risk.
That's right.
What are those?
That's right. Well, it's not preventable, as you said, and it's by no parent's cause at all. But there are some risk factors that we know about that greatly increase the risk. And what some of those are related to sleep positioning as well as sleep environment. And those are the things that we talk about primarily. The number one thing that reduces the risk of SIDS is putting your baby on their back to sleep, both at naps and at nighttime, can decrease the risk by half or more depending on what other risk factors are present.
Now, I know a lot of parents, the issue these days are you're seeing more and more kids with flat backs of heads because of this. So it's a good sign that parents are doing what they're supposed to in terms of putting their babies to sleep on their back. But there are other times that you can give them tummy time to help with that. Sleep is not the time.
That's right. That's right. And that's a big part of what we talk about with the Infant Safe Sleep campaign here in North Carolina is back to sleep, stomach to play. You've got to put your baby on your back to sleep for that whole first year of life, every time they go to sleep. But give them lots of time during the day, whenever they're awake, to play on their tummy, to, like you said, so they don't get that flat head, to strengthen their neck and arm muscles, and for developmental reasons so that they can really interact with the environment around them.
One thing that we're going to have people do is write in with questions because there are so many different factors that go into this and so many details that people want to know about. One thing I know that I personally have heard recently, when I brought my son home, as I said, just a little over a year ago, 13 months ago, we swaddled him. They swaddled him at the hospital. They said swaddle him at home. I have a friend with a newborn, and now I'm about to have a newborn, and I've heard that now, in just a year's time, they have changed it and said, now don't swaddle them.
That's right. Yeah, everything we talk about at Healthy Start and through the Safe Sleep campaign here in North Carolina is based in the American Academy of Pediatrics and their recommendations for safe sleep. And they don't have a distinct recommendation about swaddling yet, but it has been referenced and recommended that people do not swaddle their baby after the first couple of days of life because there's no real benefit to the baby, and the risk is that there could be it could turn out that what was a swaddled sleeping baby becomes a sleeping baby with a loose blanket in their crib.
It could go over their face.
That's right. And anything extra in the crib space can increase the risk of suffocation if there's lots of toys, blankets, even a blanket that you thought was tightly wound. As a parent, baby wiggles around, it could end up covering their face, as you said.
Well, that was, one question I had, and I know that a ton of our viewers have so many more questions. So if you have a question about sleep and safe sleep for your baby, please shoot us an email at mycarolinatoday@wncn.com, and we're going to have Marta back for several weeks. We'd love to ask her your specific questions. So please, as I said, mycarolinatoday@wncn.com with those questions. You can also get more information at www.nchealthystart.org. And for more general information, there is the number 1-800-662-7030. Thanks so much.
Thanks.